Hello, everyone. This is Dr. Siddharth Tambar here at Chicago Arthritis and Regenerative Medicine. Welcome to our webinar today on regenerative medicine. Before we get started, if someone in the audience can please give us a thumbs up or just say hello to let us know if you can hear us clearly. Okay, thank you. I can see that there's folks are noticing there's a little bit of choppiness with the audio. Hopefully that's been. Go ahead and get started. So we should be streaming on Zoom. Please shoot them. Please shoot them in, and I will answer them as we go along. I'll also make sure to answer all of our commonly asked questions, our FAQs as well, to help out as well. Okay, great. So here's what we're going to be talking about in our webinar today. So what you'll get from this webinar is as follows. We're going to talk about our best available non-surgical treatments for arthritis, tendinitis that do not require surgery, includes utilizing your own cells, what is legitimate and not legitimate in the field of regenerative medicine, how to choose the best physicians or clinics for regenerative medicine as well. And again, send in your questions after we're done. You can always contact us either through the website or any of our social sites or email or phone call. So the big question is, what would you do if your pain was controlled? How would your life improve? What exercises would you restart? And what activities with family and friends would you start to participate in again? So briefly, who am I? Again, my name is Siddharth Tambar, physician here at Chicago Arthritis and Regenerative Medicine. Specialize in rheumatology as well as in regenerative medicine, as well as image-guided musculoskeletal injections. In practice since 2008, involved in regenerative medicine since 2008, and part of the Regenix Network since 2012. The Regenix Network is the largest collection of physicians, not only in the country, but in the world, who are involved in regenerative medicine, sharing protocols, sharing best practices, and also, learning together as well. So my personal journey to regenerative medicine starts with my own shoulder. When I was younger, I was a tennis player. And when I started, never really had any shoulder problems. But when I was toward the end of my fellowship training as a physician, I had started to learn diagnostic musculoskeletal ultrasound, and I noticed some mild chronic tendon and ligament issues in the shoulder. And it got me thinking more about soft tissue injuries and how are we treating them. And as I've gotten older and continue to play tennis, continue to play other sports and swimming, I've developed some other sort of musculoskeletal issues, and the shoulder has been sort of an area that's been problematic. And it got me thinking more about how do we treat patients with their joint issues without things that are more harmful long-term, things like steroid injections and radiofrequency ablation, and that there's this whole scope of issues that need treatment but don't really require actual surgery. And how can we help people? And that got me interested in things like regenerative medicine back in 2007, 2008. I started collaborating with other physicians. At that time, there weren't a lot who were involved in this, which then got me progressively more and more involved in Regen Med. So traditional care for tendinitis, tendon tears, sprains and strains, arthritis, spine issues, it's really just about masking the pain and waiting for eventual surgery. The equivalent of that in other aspects of medicine would be if you had high blood pressure or diabetes and just waiting till you had your first heart attack before you did anything. And the reality is, in other aspects of medicine, we now take a more proactive and preventative approach. And we need to do the same thing in our musculoskeletal health as well. And Regen Med fits in well with that. So there are lots of problems with traditional care. Pain medications, they don't fix the problem. They have potential side effects. Traditional injections, things like steroid injections, nerve blocks, radiofrequency ablation, they have side effects. They're not really healthy for the tissue, and they're not really helpful long term. So surgery has a role for things that are more advanced in degree, but the reality is that surgery is higher risk. It can accelerate arthritis if you're getting like an arthroscopy surgery. It leads to more instability. A lot of routine surgeries like knee arthroscopy, if you already have knee arthritis, have been proven to be no better than just physical therapy. And for those of us involved in regenerative medicine, strongly believe that 80% or more of what's being done via surgery right now should be handled non-surgically with Regen Med. And the thinking is like, if in 40, 50 years ago, bad heart disease was 100% of the time handled through bypass surgery, open surgery, now probably only 5% of that is handled via surgery, and the rest is handled via either percutaneous procedures by the interventional cardiologists or medications. And so for those of us involved in regenerative medicine, we feel like musculoskeletal care is headed toward that same way. So in searching for better options, we're looking for treatments that are lower risk, avoid serious side effects, and they should address the actual source of the problem. And that includes instability, and that includes inflammation. We'll talk about that. They should improve the actual cause of the problem, and they should give you longer term improvement. So imagine reducing your pain and getting back to the activities you care about without surgery or pain medications. So what is regenerative medicine? So essentially, regenerative medicine is the process of using your body's own cells to treat your musculoskeletal issues. So if you think about what the normal healing process is, take something as small as, let's say, a cut on your finger. What happens is you have platelets that infiltrate the area first. They first stop the bleeding. They then release growth factors that then stimulate your local stem cells, which then starts a normal healing process and cascade. That involves inflammation, that involves bringing in other cells, other tissue, and eventually a normal healing process. So in tissues that have poor blood supply, that can include tendons, cartilage, ligaments, discs, labrum, menisci, they tend not to heal very well on their own. They're very hardy tissue, meaning that they're very strong, but once they've been chronically damaged, or if they've been more severely damaged, then they tend not to heal very well on their own. In addition, some folks are just more prone to instability. Let's say people are more hypermobile, and those kind of tissues can be more injured more frequently. So regenerative medicine is the process of taking those same cells that are involved in your normal healing process, that includes your own platelets and bone marrow stem cells, and then via high-level ultrasound and X-ray guidance, injecting that into damaged tissue to help you to recover. Excuse me. So why regenerative medicine? And we'll talk about this. We're treating the source of your problem. The source of most musculoskeletal issues are instability or inflammation. And we can treat both of those with regenerative medicine. This is safer than open surgery and arthroscopic surgery, effective for most musculoskeletal conditions, and again, should be able to replace a lot of what's being done surgically, not 100%, but can handle a lot of the things that are mild to moderate and some things that are a little bit more advanced as well. So again, how does regenerative medicine work? We're optimizing the damaged cells in a arthritic or tendinopathic area. We're improving the strength and stability of supportive tissues and ligaments. In addition, we are reducing chronic inflammation, and we're also improving your overall neuromuscular health. All that together leads to less pain, better function, and overall better quality life. So what makes a regenerative medicine expert is a lot of different things. This is a very busy slide, but let me go through this quickly because it's important to understand this. Number one, your physician who's doing these kind of treatments should be a musculoskeletal expert. And that means that your doctor should be dedicated to this. They shouldn't be treating somebody's high blood pressure in one room, their erectile dysfunction in another room, their testosterone replacement elsewhere, and then jumping in to help out with your knee and your back. That's not a proper musculoskeletal expert. They should be 100% focused on joint and tendon issues. Number two, they should be a non-surgical expert. There's a lot of different fields that deal with musculoskeletal problems for people, and they have different approaches to treatment. For these kind of treatments, there's specific skills that you need. Our orthopedic surgery colleagues are very skilled at surgery. That's what they're trained in. They don't necessarily have the kind of image guidance skills like high-level ultrasound and X-ray guidance that is required to really do these procedures correctly. You need that image guidance because if you're injecting a steroid that's fat soluble, you can inject anywhere in the body and you'll get some anti-inflammatory effect. With these kind of regen med treatments, you can't be just close to the area that you're treating. You have to be very precise. And I'll show some images of what that means. But for example, if you're injecting a rotator cuff tear, you can't just be close to the shoulder. You have to be at that 1 millimeter by 1 millimeter level where people have problems. If you're not using image guidance, you're basically just trying to pick a needle out of a haystack. And that's not the right way to treat people. And the next thing is your physician should understand how inflammation helps you heal. I have colleagues in particular pain medicine colleagues where they'll utilize a lot of steroid injections, nerve block treatments, not understanding that that is counterproductive long-term if you've got an instability issue. And long-term chronic inflammation is bad because it's your body not functioning correctly, but short-term inflammation is your body's normal way of trying to heal. And so in the case of the regenerative medicine treatments, you do get a short-term uptick in inflammation, but that's okay. That's actually helpful. And so understanding how inflammation works is important. The next is that, these are not one-size-fits-all treatments. They're different ways of prepping your different cells. They're different types of biologic treatments. And your physician should not have a perspective that, you're a nail and they're a hammer and like everything is the same thing. That's not how these treatments work. There's a lot of subtlety to this, which I'll discuss a little bit later. And so a personalized approach, a bespoke approach is the right way to do this. This is not a generic one-size-fits-all approach. Your physician has to have a lot of nuance and dexterity to this in terms of your case and your treatment. And the next is they need to understand how prolotherapy works. I'll talk a little bit more about prolotherapy later, but prolotherapy is this idea that you treat instability and you get a much better result. Most physicians don't know how to do that, and I'll explain that in a little bit. But because of that, they don't get the right kind of results because of that. And then, of course, your physician should be very transparent regarding results and your candidacy for treatment. I have colleagues that, may be trying to do these treatments now, but 5 years ago, they thought these treatments didn't work at all. 10 years ago, they didn't know anything about these treatments. Your physician should have a deep level of experience with this so they can be very clear about, are you a good, fair, or poor candidate? And how can you improve your candidacy as well? And next, they should follow your results long-term. Your physician should not be just doing a procedure and you never see them again. They should really be following you through this long-term, and they should be guiding you through this process, really understanding how to handle your questions and how to do this